Okay, great. So first of all, welcome everybody to this panel discussion. And our topic will be the community scale. How do we provide community scale data using the satellite data information from NASA? Here, I chose 3 examples from my last 4 years of work with HAQAST. And I think these 3 examples would demonstrate very well why HAQAST team has a unique position to connect the NASA satellite data with the community. So the first example is team efforts for identifying major problems. In this example, I show here, we actually published a group team collaborative paper last year led by myself and Tracy Holloway. We have 17 co-authors on this paper who are either HAQAST team members or collaborators. And in this paper, we try to demonstrate some of the major problems that are still existing in publicly available, frequently used PM2.5 dataset in the contiguous US. So as you can see, we have a map here with 4 different datasets. They are generated by different methods. Some of them has just monitor data, some of them has satellite and monitor, some have model and monitor, and some of them have all 3, model, satellite, and monitor. And yet, they do not show a consistent story. We compare this only for the year of 2011 as an example, because we don't have a lot of years with them overlapping with each other. But in just this one example of 1 year, we can already see, depending on which data set that the end user download, you could actually have totally different public health assessment results just because of the input of PM2.5 data are different. And another lesson that we actually learned from this team effort is guidance is definitely needed for end users to access and critique various data sets. Not only we need to provide easy to download data sets, but also the instructions of how do you interpret the data differences and how do you find the best data for a certain goal is also very important, such as different regions, or if you're looking at annual mean or daily average. So those are something we learned in the team effort. Now, the second example is HAQAST team has an advantage of bridging the gap between data and end users. So this is one thing I learned in my 4 years with HAQAST team, that we constantly talk with our stakeholder collaborators, and sometimes we'll be inspired by the type of questions they ask. Say, one thing when I started with HAQAST, I know that it would be nice to provide long-term PM2.5 dataset in California. So it wouldn't have any data gaps in certain days. And also we can have a spatially homogeneous data set that wouldn't be like the monitor data that you have gaps in different neighborhoods. And as the product is produced, we realize that just having these data in NetCDF form or in the Excel form is actually not very helpful to our stakeholders. Sometimes people want to have easy to access data that you can just play with, such as a visualization tool like a map. And here we go from this evolution. We first provided these daily data in downloadable data format, but then we start to provide these daily maps that people can just go in and take a quick look. And this actually becomes very helpful when you just want to quickly identify a daily hotspot, or if you want to identify the communities that are often subject to these high PM2.5. Some of the keywords that I learned from our stakeholders that what they want to see is they want to see high resolution, which is community scale. So far we can provide 3-kilometer resolution for the entire state of California. And we are working towards the next step, a future perspective, which is to provide 1-kilometer scale throughout the entire state of California. And we are also providing daily data output for California, and it is near real time, which means within 24 hours of the swap of the satellite, we can actually already upload our data set and the maps into these websites that you can just open and see. So I want to show you a visualization map that we actually developed. It's a lot of fun to play with. So first of all, you can go to my HAQAST webpage, and then there will be a link to different days. And this is based on the ArcGIS platform. If I select a certain day, such as 2016, December 29, I can zoom in and see what is happening in the Bay Area. Here, you can clearly see some hotspot that is hugging around the highway in the Bay Area. And if you're familiar with Bay Area, you will know there are several major airports. For example, here is a hotspot for San Francisco International Airport. And we also have a hotspot here in San Jose. That is another international airport. So very interesting, where we see the higher pollution also seem to spatially correlate where these big emitters would locate. Now, coming back to my last slide, the third example. This is also a challenge. As a HAQAST team member, we're often subject to very urgent, fast requests by the stakeholders. So we need to be adaptable to these needs by the stakeholder and give fast response. One of the Tiger Team study is the health studies of 2017 California wildfire. So in order to provide health study estimate, our team is actually in the first row to first provide the satellite data that can generate the PM 2.5 data. So we use some previous methods, but because this is wildfire season and this is just for California, we have to optimize those methods, those algorithms to recalculate the PM 2.5 that combines monitor and satellite. But this is just an example that we learn to do things not only adapting to the need of the user, but also do it very fast. So with that, I want to hand it to Jason because he actually is one of our users of the specific satellite data for wildfires.
Hello. Hi, my name is Jason Bargo. Can everyone hear me?
Yep, you're coming in good.
All right, great. Thank you, Minghui. As Minghui said, I'm Jason Vargo with the California Department of Public Health, and ironically, I used to work down the hall from Tracy and Dagan, and didn't really work on HAQAST very much. But then I moved all the way to California, and as soon as I got here, I realized that wildfires are a big problem and a big air pollution problem. And working for the Department of Public Health here on climate change, it became a big part of my job. And so that really plugged me into HAQAST in a big way coming out to California. So it just took moving across the country to get involved with the work of my colleagues down the hall. So what we've been doing in California is really trying to not only understand the environmental health burden of wildfire smoke and climate change more generally, but also connect it to policy and especially to investments from our greenhouse gas reduction funds. And so we want to really understand at the community scale how communities are being impacted, where the most impacted communities are. We want a time record for these exposures, so we can look longitudinally at cumulative burden of wildfire smoke and other exposures and climate-related exposures over time. And that really led us to look at satellite products that were regularly processed and available over time. And one product that we turned to was the NOAA HMS product. But then in our conversations with the Tiger Team and HAQAST work group in California, we got plugged in with other scientists who were producing more detailed products that gave us sort of time series estimates of air pollution over time, and we could begin to think about community impact of wildfire smoke over time. And really, the collaboration that I've worked on the most through HAQAST has been with Dr. Mohammed El-Hamdan from NASA in Alabama, where he was producing surfaces of PM over time, fine scale for California, and we began to think about how we might do a sort of quick and simple data fusion exercise to begin to understand the wildfire specific portion of PM that communities were being exposed to over time. The way that we did that was pretty simple. We sort of, I'm sharing my screen now, but you can see, here's an example from November 10th campfire 2018, where we tried to bring together these different data products and start to understand what parts of the state are being most impacted, what's the scale of that impact, and then work closely with not only our environmental health investigation branch to do research on the health impacts of this and connect it to health records like emergency department records or Medicare or Medicaid records and examine the burden that way, but also begin to try to connect it to policy. So we're beginning to create surfaces for California over time about wildfire smoke impact for community. And what that has what that's also allowed us to do it's allowed us to combine it with other social determinants of health that we understand at the community scale. And so we worked closely with our Air Resources Board in the state to use this longitudinal record about which block groups had experienced the most heavy wildfire smoke days over the course of a decade, and begin to understand not only where is the smoke exposure happening, but where do we have sort of coincidence of wildfire smoke exposure and then community need in the way that we defined community need in this case was sort of defined by the pilot project itself. So the pilot project was, again, targeting schools, and we said, okay, where's there an overlap of exposure and low-income schools, for example? And so not only were we able to sort of describe the cumulative burden of a decade of wildfire smoke exposure, but we began to isolate the parts of the state where we had not only concentrations of wildfire smoke exposure over a decade, but also concentrations of school-aged poverty. And we began to very specifically target the pilot project to those places where we think there's the greatest need and where they'll be able to do the most benefit or provide the most benefit to the community. I should have said at the beginning that I sit within a climate change and health equity program. So the types of social determinants of health that we understand at the neighborhood or community level are really important. And like I said, we are always trying to incorporate that into our understanding of environmental hazard, public health benefit from public investment. And it's something that we're extending to the COVID research that I've been sort of permanently redirected onto for the time being. And I just wanted to show you one slide on that, if I could quickly, which is unrelated to the HAQAST work, but I think there's going to be a lot of applications for the HAQAST work going forward, and understanding the interaction between this environmental health hazard and infectious disease hazard. So when one thing that we looked at real quickly in the state is to understand different census tracts around the state and look at PM exposure in addition to all these social determinants of health. But one thing that we've noticed right away is that week to week, we look at case rates in the census tracts of the state that have the highest concentrations of PM 2.5 and the lowest concentrations of PM 2.5. And this sort of pattern of the divergence between the worst off census tracts in the state and the best off census tracts in the state, whether it's poverty or access to healthcare or crowded housing, appears over and over again, and it appears again with air pollution as well, that we see elevated case rates in the census tracts, the communities that are experiencing the poorest conditions for living a healthy life. So I'll stop there, and I'm happy to take questions, but thank you for inviting me to be part of this panel today.
Minghui, shall I just jump right in? Okay, great. Hi, I'm Pat Kinney. I am a public health scientist with a background in air pollution epidemiology and exposure assessment. I was a co-investigator on 2 of the HAQAST projects over the last 4 years, one led by Arlene Fiore and the other by Davin Henze. As we've heard, I think particularly in the earlier session with Mike Brower, epidemiologists often use entire cities as units of observation. That's been the major way that we've learned about the long-term effects of PM2.5 by looking at multi-city studies. And that same kind of information has been a really important input to burden of disease estimates at the global scale, but also to setting of air quality standards in the United States and other places. So it really works well. You only need sort of one monitor per city for that kind of work, and it's been really informative. But when I started working with the HAQAST group 4 years ago and began to interact with local stakeholders, I began to realize that the questions that they were asking demanded data at a much finer scale. For example, what's the burden of air pollution in my city, and how does that vary by neighborhood? Can we do epidemiologic studies that link fine-scale patterns of health data that the health department might have at the neighborhood scale? Can we link that to air pollution data within the city and sort of understand what's going on with health from an epidemiologic point of view? And for many cities in the US, even though the national standard for PM2.5 is being met, there still remain hotspots. And it's important to identify where those are and also to understand the sources that are impacting the hotspots, and then in turn to intervene to try to reduce those emissions, and then have data that can allow you to track or to evaluate the effectiveness of the intervention. So all of those kinds of questions really kind of call for finer scale data. So I remember the first meeting I attended at Emory 4 years ago, we started posing the question, can we combine remote sensing data, land use data, and high density ground-based monitoring of air pollution to develop statistical models and other kind of tools that can get you down to a scale of something like one by 1 kilometer or even finer, which would be the scale that urban public health decision makers kind of need to answer some of those questions. So that's what we've been referring to as high-res modeling, and we've heard a lot about that over the last 2 days. Now, of course, AOD from NASA is now available down to about a one by 1 kilometer, which is great. Land use data that could also be informative goes to even finer scales. The problem is the ground-based air pollution measurements are sparse. At least the regulatory monitoring stations are quite sparse, and too sparse really to help to tune models at a fine scale. So the high-res Tiger team, which I led, which started a couple of years ago, was really aimed at trying to address that challenge of how to put those 3 kinds of data, land use data, remote sensing data, and ground-based measurements together in a way that's informative at fine scales. And we took a two-pronged approach. One was to do some field testing of a novel low-cost PM2.5 sensor that's based on passive sampling methods. So it's designed for long-term sampling to get an annual average, which is the exposure measure that's most correlated with the adverse health effects, as we've talked about. The second approach was to develop new methods for combining low-cost sensor data with land use and remotely sensed data. And I was fortunate to, one of the values of the HAQAST model and the Tiger teams is that you get to sort of quickly form collaborations across a very diverse team. And I was fortunate to have a large number of HAQAST investigators helping out with that project. And we, for the field monitoring, we actually did sampling in 3 cities. We set up passive samplers in Boston, in New York City, and also in the Bay Area. A total of 8 sites, and we monitored for 1 full year. These were at sites where high-cost regulatory monitors were also being run, so we could do a comparison of the co-located low-cost sensor with the regulatory monitors. And right now, I'm going to, if Paige, if you could give me this, yeah, I'm going to share my screen if I can.
Yeah, you should be all set to go, Pat.
If I can do it, I'm going to. During the last talk, I was trying to find my PowerPoint, and it was not showing up, and I don't think I saved it actually. No. I do have a slide that I can show you, I think. Well, you know what I'm going to do? Yeah, for some reason it got lost in translation. I'm just gonna talk through this. We got a couple of really nice products out of the project. One was this correlation, the co-location study of the low-cost sensor with the regulatory monitors. And we found a pretty good correlation, about a 0.7 correlation on the annual average between the low-cost sensor and the regulatory monitors that were co-located. So that's one of the slides I was going to show you. And then the other thing is, working with Yang Liu and Mohammed and others in the HAQAST team, we used some machine learning algorithms applied towards data for New York City, where New York City was an example of a place where they already had a very high density PM2.5 monitoring network, the NICAST monitoring network, and we were able to sort of test the idea of using lower cost sensors to improve model fit. And the paper that Yang's grad student published 2 years ago really showed for New York City very graphically the added value of those data. We did similar work in California, which is very, very impactful. And I think this is this idea of combining low-cost sensors, including the purple air sensors that are becoming quite prevalent that Yang Liu and his students have been analyzing. I think it really points the direction towards a whole new way of getting fine-scale data in the future. So I'll stop there. Thank you.
Great. So I'm going to go ahead and jump in. My name's Sarah Johnson. I'm the Executive Director of the Air Quality Program at New York City's Department of Health. I don't have any slides for you today, so I'll just tell you about what we do. I oversee the New York City Community Air Survey, which Pat mentioned, NICAST, a neighborhood-level air quality surveillance network that we have run since 2008. We monitor 5 criteria pollutants at 90 locations throughout the 5 boroughs of the city and produce seasonal estimates for each of New York City's neighborhoods. We make a lot of effort to communicate these findings to policymakers, funders, program planners, community advocates, and residents. Being able to tell a story with data that is specific to a neighborhood is powerful, a way to make people care and take action. We also carry out research in health effects of air quality and temperature and estimate health impacts of various policies, including New York City's elimination of residual fuel oil burning in buildings and their greenhouse gas emissions reduction strategies. We have worked with HAQAST projects in 2 ways. We have shared our air quality data to be incorporated into the processing and validation of the satellite data. And we have worked with teams preparing near real-time spatially resolved air quality data for New York City. We are very excited about the potential of satellite air quality and temperature data to allow us to track neighborhood trends and as exposure metrics in our health effects modeling. We have not gotten to the point of testing the data products in our models yet, however. One of the ways that we are looking forward to using the data is in our syndromic surveillance system. We currently track asthma ED visits in near real time and look at the relationship with air quality so as to detect potentially unusual events that require some sort of a response. At this time, we use a citywide mean value from our regulatory monitors to measure daily air quality. Having a more spatially resolved exposure source would definitely improve our surveillance. We really value the opportunity to work with NASA data and scientists in an active collaboration such as this, where we are able to have input in the scientific process, bringing not only our local knowledge, but our understanding of how these data products could be used in pushing policy and evaluating programs. At times, there are spirited conversations during conference calls that sometimes result in a reevaluation of a process or something like that. But a more useful product we believe is always worth the wait. Thank you for inviting me today, and I look forward to our discussion.